So today we decided that we will be focusing on mental health and the healthcare practitioner. These are my group members, me, Zaleesha, Hymne, Kwazi, and Olwam. So what is synthesizing? We believe that synthesizing is the act of combining different ideas or information to make a whole new and different idea compared to the items considered separately. Now, why is it important to synthesize? It is important to synthesize to ensure that one can demonstrate the understanding of the literature and information, as well as being able to see if the writer has the ability to connect ideas and develop an argument. Synthesizing is also important to draw on multiple sources to make a new or broad conclusion. Thus, it also prevents plagiarism by transforming external ideas into your own unique analysis rather than directly reproducing them. Now, what advice or guidance can I give you on synthesizing information effectively? So, step one, it is very important for you to read your source and to understand what that source or article is about, what its content is about. Second step, it is to look for the similarities and differences based on each source or article's content. Step 3, summarizing the main points of each article, which thus will help in step 4 develop our own idea or a broad statement based on the information provided by the articles. Step 5, it is important to use the article as the point of references. And step 6, create a conclusion. Now, we decided to synthesize on the mental health and the healthcare practitioner articles. While synthesizing these articles, we had found some similarities in the stresses for both articles. We noted that both articles mentioned the heavy workload, the stigmas that seeking help could be a sign of failure and weakness, and cultural vulnerability. The implications that we found similar were the ideations of suicide, the medical errors which led to reduced efficiency of patient care, and the mood disorders which led to emotional detachment. Now, the similar suggestions that we found in both articles was number one, to practice self-care. Number two was the reduction of the stigmatization to promote help seeking. Number three was to build supportive environments which were based on trust and transparency. And number four, to eliminate unnecessary burdens, to create more realistic workload expectations, and also to improve work-life balance. Now, there were a lot of differences we found in each article. Like, for example, in Article 1, the focus was on physicians, where we also noticed that the different stresses included the emotional demands and the administrative burdens. The implications included depression, anxiety, and substance abuse. And the suggestions included the improvement of an individual's resilience. Thus, The results showed that the physicians that are burnt out are associated with high risks of both anxiety and depression. In Article 2, we can see that the focus was on COVID-19. The article focuses on the impact that the global pandemic had on nurses, females, and frontline workers. The COVID-19 pandemic also increased the psychological distress and the PTSD amongst many healthcare workers. Stresses that were noticed were the moral dilemmas. Implications included exhaustion and motor vehicle accidents. The article had some suggestions which included having a daily routine to enhance positivity, whether that's with exercising or doing any personal mindful activities. It also suggested that the health practitioner should be prepared for future pandemics and also encourage the participation in local programs that support mental health. So, in conclusion, protecting healthcare workers' mental health is a necessity. It is not an option as it will affect a patient's care, a patient's safety, and the sustainability of the healthcare system. Thank you so much.